Welcome to the Yarn Up, everyone. Hello, my name is Sam and I'm the clinical manager at Katungul. I'm here with our lovely Dr. Tom Keaney down at our Bega clinic, and today we're going to answer some questions in regards to the COVID vaccine that you out there in the community have submitted to us and are curious. So hopefully we can give you the correct answers and know what we're doing. We ask that you remain on mute if you join us, to make sure we don't get any of the background noises, but feel free to chat and pop up any questions, type your questions in. This is a safe space so we ask you to respect each other's questions and opinions. We're here to talk specifically about the COVID-19 vaccine rollout. However, if you would like to get in touch, there is a formal feedback process available on our website at www.katungul.com.au, or just head to our contact page on our website and you can submit and feedback any of your questions out there that you don't want to ask at the moment. So we've got some handy questions that have been given to us that Dr. Tom here and myself are quite willing to answer for you. So, okay, let's get into it, Dr. Tom.
Oh, great, Sam. Thanks for the introduction.
No worries at all.
Yeah.
Okay, so we're just going to fire them away at you. So one of the big questions that we have been asked in recent days because of recent events that have been on the media in Australia is, did the people who have passed away from COVID in the past few days die from any of the vaccines? So I think both Tom and I can go, no, they haven't. There has been no record of anyone having passed away who has been fully vaccinated.
And I think the important thing, Sam, also is that there's been a bit of publicity about the younger bloke who died in Sydney a couple of days ago. And the important thing to note with him was that he wasn't vaccinated, but also in fact that he wasn't vaccinated. So I think that's a really important thing to note. He's a young man in his 20s who died and who had no preventative measures to protect himself from the COVID disease.
So the important message there is we need to be vaccinated, fully vaccinated, for 2 doses.
Yep.
The next question that we were given was, we're not sure of our eligibility. So what vaccine can we actually receive? Now, with this one, Dr. Tom, you'd be advising that if you are unsure or have any questions in regards to what you're eligible, you can make an appointment with your GP here at Katungul clinics and speak specifically and confidentially with them. Or you can go onto the eligibility checker, which can be found on the Katungul website, or you can go to www.health.gov.au. But I think the most important message there to get out is that at the moment, AstraZeneca, if you're 60 and over, you are eligible to receive. If you are a child from 12-year-old onwards, you can receive the Pfizer of being Aboriginal and Torres Strait Islander. But also knowing that AstraZeneca is available to anyone of 16 years and over, as long as you are seeing your GP if you are under the age of 16 to get your medical advice.
Yeah, that's right. So just to reiterate what Sam said, that was great summary, Sam. So AstraZeneca, if you're older than 60, is recommended by Teague, the peak body who discusses immunisations. Pfizer is the vaccine the recommended vaccine by Teague if you're 60 or under. Anyone is eligible for the vaccine for AstraZeneca as long as they get medical advice first. So that was really well said, Sam.
Thank you, Dr. Tom. One of the other questions, which I think nearly all of us are, is, I'm scared of needles. What do I do? Dr. Tom, isn't that a common question we get?
Well, it is, and Sam told me she'd hold me down and just give it to me before. No, I don't believe that for a second.
No,
You wouldn't catch
absolutely
me. You wouldn't catch me. So look, the reality is that look, we're all scared of needles. All of the staff at Katungul are trained healthcare providers. We've all got years of experience between us. We're all incredibly careful and respectful about people and their opinions and their fears. And in fact, we're all very good at needles. We know people are frightened, but we're so careful that the experience really won't be too bad. Yeah.
And we will hold your hand.
Absolutely.
One of the biggest questions, which even the media has been speaking about, is what are the side effects of the vaccine? Now, we have 2 vaccines, Pfizer and AstraZeneca. Dr. Tom, did you want to talk about the Pfizer? And I'm happy to take AstraZeneca, or
sure.
vice versa.
Well, even to be honest, Sam, and I think the way whenever I talk to someone who comes into the clinic about the vaccines and prior to getting their consent to giving them an immunisation, whatever it is, we talk about sort of common and uncommon side effects of vaccines. The common side effect of any vaccine really is going to be pain at the site of immunisation. It's common for people to get sore lumps under their arms a couple of days after the vaccine. It's common for people often to feel like they have a flu-like illness, which might include things like muscle aches, fevers, or sweats or chills for a few days. They're really or feeling unwell. The advice which I give to people who come into the clinic, regardless of what vaccine they're getting, is most of these symptoms can be managed with simple measures like paracetamol and rest or Nurofen. The specific, the uncommon side effects which we're worried about with the Pfizer vaccine is first of all an immediate big, anaphylactic or big response to a vaccine, which is why we tend to keep people in the clinic for 15 to 20 minutes after they have either of the COVID vaccines, and particularly if they've had any form of anaphylactic reaction or big reaction to medications or bees or anything like that before. There is another reaction which has been documented with Pfizer. It's called a myocarditis, which is a medical word which talks about really inflammation around your heart. It's incredibly rare. Its incidence is 1 in 1 million people if you're or 2 in 2 million people. Sorry, 2 people per million vaccine doses if you're older than the age of 30 for either a man or woman. It's a little bit more common than that if you're younger than 30 and you're a man. But again, it's incredibly rare. It's really the thing to note is that people sort of get a sharp chest pain, and we'd encourage anyone who has this symptom to get medical help regardless. And if you do get those, or medical assessment regardless, and if you do have the symptoms of chest pain, maybe a bit of shortness of breath, and you have had the vaccine within the last 1 to 5 days, really is a time frame for the myocarditis, I understand, to present, then it's just worth letting the medical team who you're seeing know that you've had the vaccine and you've got those symptoms. But it's incredibly rare, it's incredibly treatable, and people are on the health professionals throughout, all the health settings from Katungul through to emergency departments, hospitals anyway, are on the lookout for the side effects and complications of the vaccine. Yeah. What about you, Sam? You happy to talk about the AstraZeneca vaccine at the moment, or?
Yeah, no, Tom, that was a fantastic answer and very clear and direct. So well done on that. AstraZeneca, well, you pretty much nailed it with the side effects as well. They're very similar to the Pfizer. Pain, swelling, tenderness, tiredness, your headaches, muscle pain, joint pain, just feeling unwell. Typically the same type of sort of side effect that you would get even with any other type of immunisation as well, any type of other vaccine. But that brings us to the next major side effect, adverse reaction, that everything with AstraZeneca is coming out in the media, is our blood clotting side effect, which is extremely rare. But as Dr. Tom, you're the GP, I would love for you to explain, because you were so in depth with that last question. So I'm going to hand that one over to you with the TTS.
Thanks, Sam. It sounds like you're just throwing me into the firing line again here. So TTS is just, I suppose, a short way of describing what the medical name for the clotting disorder is, and it's a thrombosis with thrombocytopenia syndrome. What again? That's a medical term which really describes sort of it really describes that people. There are some people who've had the vaccine who get blood clots in some of the blood vessels through their body. The reason why people get it, it's thought to be an immune response that the body has against the vaccine. That is, the body is fighting, the body is reacting to the vaccine, and it in a way it reacts to part of the blood cells which are involved in clotting, which is why people get the clots. I know initially, early on, there was a lot of publicity with AstraZeneca about the clots, particularly clots within the brain. Sam, just out of interest, when's the danger period for the clots? Do you remember when the danger period for the clots for TTS is?
For the TTS, it was within the I believe it was within the 1 to 7 day range at the beginning, but that information has recently changed.
Let's have a look on. Can we have a look on the COVID vaccine information paper and we'll just talk about it? So
I think that would be a good idea,
because they're a great website available through the Australian government. So that's a question I noticed for Sam. You can find out when the clots are most likely to occur. So when you get your AstraZeneca vaccine, when you need to be mindful of when the clots are going to occur. The clots can occur in different parts of the body, from your legs to your tummy to your lungs to the blood vessels surrounding your brain. The really important thing to know about the AstraZeneca, the TTS syndrome associated with. So I've just thrown Sam into a.
You have just thrown me back under the bus, because I've got all my information here that has been lovely provided by the Australian government, as you can see. So I'm just going through that information to ensure, but we'll actually get back to you. Thanks, Dr. Tom. I will ensure I actually give you that answer.
Anyway, so while I'm talking, Sarah's going to be busily looking up.
I am. So I'm going to hand it over to Dr. Tom for the second, and he can keep talking to you about the blood clotting.
Yeah, that's right.
But also, Dr. Tom, why I'm finding that answer, maybe you could talk about the vaccine and the fact that that people think it was created just to be too quick. And how could it properly be tested? Maybe I can leave that over to you, and I'll find that guideline information very quickly. I'll be back.
No worries. So basically, I'll finish off just about the TTS, the clotting syndrome first. The reality is that it's a condition which is really rare. It occurs. The clots occur between one person in every 100 and one person every 300,000 people who get the AstraZeneca vaccination, so it's incredibly rare. The syndrome which is associated with the clots has been highlighted amongst all of the health professionals who are working within New South Wales, so that includes Katungul staff and emergency department staff. The way in which the clots, people with symptoms with the clots are investigated is really well documented, and it involves a series of blood tests and some scanning. And almost invariably, every person who's got symptoms of the clot will be discussed with a specialist haematologist. The other really important thing to note about the clotting disorder is that it's been really well, I suppose it's been so well investigated and looked at that there's a very specific way in which the clotting syndrome is treated, which has really in fact reduced the risk of people getting really unwell or dying from the clots. So in the last few months, the process of identification of people with the clots to investigation of people with the clots, to treatment of the people with the clots has become really quite streamlined and has really improved. And in fact, your risk of getting really unwell with the clots and dying, I understand it has decreased significantly. Yeah. Sam, so did you find out that information?
I have found that guideline for you, and the guideline is very similar to what I just said. It can take effect from 2 to 5 days up to 7 days. There has been reactions, and the TSS has been actually found up to 7 days. So from 2 to 5 is the guidelines, but there has been cases where it has appeared 7 days post the vaccination.
Thanks, Sam. Fantastic. And just to reiterate, that information was found on readily accessible Australian government website pages.
Correct. Yes.
Yeah.
Yes.
Look, Sam asked me to touch base with the next question, which is common, which people sort of express. They talk about how they don't trust the vaccine because it was created so quickly, and how could it possibly be tested? I suppose, Sam, it is important to know that or to consider as health professionals as we are, we're treating people or we're offering an immunisation to people who are worried about it. But in fact, the vaccine was really researched and had a lot of clinical trials done really, really quickly. And I can sort of see that point of view from people, to be honest.
I can understand why there is fear there, but it needs to be known that no steps were missed in regards to this vaccines. They all went through the rigorous steps to ensure the safety of individuals. There was major clinical trials attended. Our ATAGI, our ATAGI, which is the Australian, I can't read your writing, I'm sorry, Tom.
So ATAGI is the Australian Technical Advisory Group on Immunisations.
See, nurses, we love our acronyms, but when it comes time to saying what they actually stand for, we cannot say it. So there you go. Or we can interpret it. Or doctor's writing, there you go. So the steps have been taken in accordance. They are safety. They've done many clinical trials. The vaccines are extremely safe. So we cannot get that out any more clearer. They are very safe to accept and take.
So Sam, if I can add on one more thing. The reality for the process of the trials, and this is coming from me having the opportunity to talk to some medical colleagues in England, was that when people were getting sick in England and the other countries around the world, there was a lot of research and development and technological innovation which was channeled into looking for vaccinations against the COVID virus. And any vaccination which was found to improve immunity of people and reduce the risk of catching the disease or risk of severity of the disease, was I suppose was accelerated in terms of clinical trials, and a lot of people were funneled into checking the safety and how effective those vaccines were in these condensed clinical trials. So people were funneled. The more effective they were found to be, the more people were funneled into the trial. So over a short period of time, literally tens to hundreds of thousands of people were involved and engaged in the various levels of the clinical trials to prove the safety of the vaccines. What's really important is not just about thinking that the vaccines are safe, and they are safe, but actually considering that the vaccines, without doubt, and I know I've been a bit silly and goofing around a bit doing this, but without doubt, the crux of this web meeting is that the vaccines reduce the risk of individuals, of family members, of communities getting sick. They reduce the risk of individuals, of families, of community members dying. And that has been shown from the US across the Atlantic to the USA. It's actually reflected the statistics which are being produced in Australia in response to the Delta virus, the Delta strain of the virus of COVID being with the current pandemic, which is occurring in Sydney, New South Wales. By far the majority of the people who are intensive care and sick are either not vaccinated or they're partially vaccinated. So just to really really, you know, I just want to, it's really important to me as a doc, because I'm here to look after the community, you know. I just cannot stress strongly enough that yes, the vaccine was created quickly. There certainly was a process of clinical trials which not only looked at its safety, which documented that it works, and this has been shown throughout the world. And it's so important to protect yourselves, to protect your families, and to protect the community. Well
said, Dr. Tom. Well said. Yeah, we may have goofed up in here and had a bit of fun together, but that message is just so strong from Katungul as clinicians, as community. Yep, we can't stress it enough. So well done, Dr. Tom. I could hear your passion behind that one. Some of the other questions in regards to our community members that were asking is they're worried that if they can't get into the clinic to come and get their vaccines, whichever one they're eligible for, what do they do? One of the biggest things that we can offer is we can offer you transport. We can offer you to an allocated booking time, and we can arrange the transport to come and pick you up and bring you into the clinic so you can be vaccinated. So if you are concerned because you cannot get to us, please still reach out to us. We will do everything that we can to get you in here to be vaccinated. The number that you can call is our Katungul number, as you know, 1800 804 201. So please call it. It's free, 1800 804 201. Some of the other ones is, well, we're just going to do a bit of doubling up here, is what are the vaccinations that you can get at Katungul presently. So it's AstraZeneca, yeah, and we are just about to start rolling out the Pfizer in the next few months. Katungul was able to become a Pfizer hub. The Pfizer is going to be offered very, very shortly. So please, 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 again, ring that number, 1800 804 201. Talk to our receptionist, get your name on the waiting list, and get booked in.
Next question is, can I get a vaccine at Katungul if I'm non-Indigenous but my partner is Indigenous? And I believe the answer is yes.
Absolutely, absolutely, yes. That is 100% a yes. That is part of the guidelines. That is stipulated by the government. Yes, if you got a partner who is non-Indigenous and you are Indigenous and they live with you or have any type of connect, they are entitled to get it as well. Another one, Dr. Tom, do I have to be a Katungul patient to get the vaccine? Yes, you do. This is not just because Katungul needs the record. We actually need your details to ensure that we register you correctly, that you have received the vaccination through AIR, Australian Immunisation Register. Not only that, we need to ensure that we have your medical background so that if you have got one of these rare types of medical conditions that doesn't allow you to receive the Pfizer, or that we need to keep a closer eye on you to get the Pfizer or the AstraZeneca. So that's where the doctors will come in, they will do your assessment, and they ensure they know everything to ensure that we are giving you the correct treatment and the correct advice to ensure that everything goes smoothly.
Yeah, that's right, Sam. So getting a vaccine is an important part of medical treatment. You know, in this current environment with COVID being around, we have our processes which ensure quality and safety.
Yes.
One of those processes ensure that we treat Katungul patients, and that we have as much information, medical information about medications and allergies, for example, to be able to treat people with as best as we possibly can. So yeah, absolutely.
Yeah. The next one is, do I have to have the same vaccine for the second dose? The answer quite straightly is yes, you do. If you get the first Pfizer or the first AstraZeneca, the next dose, your second dose, will be the same. Some of the other questions, Dr. Tom, is that we've had some Indigenous women of our community ask, should they be vaccinated if they're pregnant or if they're breastfeeding? Again, guidelines have stated that you can receive your vaccination when you are pregnant and when you are breastfeeding.
Yeah, I think it's encouraged as part of antenatal care, routine antenatal care.
Very much so. It's a new guideline that's just come in. Yes.
Yeah. So if I'm mistaken, we'll get information up on the web. But I'm sure the importance of protecting both mum and bub during pregnancy from the COVID infections being recognised, and so I understand there's a real push to make sure all pregnant women are vaccinated with Pfizer.
Yes, with Pfizer. Yes.
Yep.
And as you may have also heard, we're coming to the end, but we just would like to get it out there too, because the media has also released about children aged 12 to 15 able to receive the Pfizer. That is correct. So there is new guidelines that have been released just recently in regards to children aged 12 to 15 that is able to actually receive the Pfizer. There are guidelines around which children can receive it, but all Indigenous children aged 12 to 15 are able to receive the Pfizer. Well, Tom, that brings us to the end of our Q&A with regarding the COVID rollout and the vaccines. I hope you've enjoyed listening to us and us being able to answer your questions. Tom and I have goofed off a little bit, but that's just how we are, and that's our Katungul coming out in us. But do know that we are here to support, we are here to help, we are here to answer any questions, and if we don't know, we will find it out, because things do change, as you have known, and we do ensure that we are up to date with the very recent guidelines, evidence-based, and we ensure we give you the absolute best safety in regards to healthcare.
Yeah, that's right. So look, again, from what Sam said, we've got a great relationship where we often digging each other, but honestly, the priority of Katungul, all Katungul staff, is keeping the community safe.
And again, Dr. Tom, anyone who's still feeling unsure, even after this webinar, this Q&A, we encourage you still to come in, book an appointment with one of our Katungul GPs, 1800 804 201. Come and have a yarn with us. That's what we're here for.
Yeah, absolutely.
Bye.
Bye.